No one likes a long wait in an emergency room. Well, it turns out you might be able to avoid it. In tonight's To Your Health, 13's Melissa Bruner will look at when urgent cares could be a faster option and when you should just skip that and head to the ER.
Emergency rooms are your best course of action for life-threatening emergencies.
Chest pain, shortness of breath, stroke-like symptoms, major injuries that might result in hospitalization or aftercare.
But Dr. Miranda Fowler says many people wait it out in the ER for things that could be handled at an urgent care clinic like the Stormont Vail Express Care where she works.
We can get people in and get them taken care of without them having to have an extended wait in the emergency department, and then that leaves the emergency department's resources to take care of the true emergencies.
Fowler says Express Cares have x-ray capabilities, which means they can treat and stabilize many fractures.
The biggest differentiation is if you can see the bone. If the bone is protruding through the skin or is associated with a complex laceration or opening in the skin, those need emergent care.
Cuts also can be stitched up.
We can manage most lacerations, even multi-layer lacerations at the urgent care, if you believe that you have arterial bleeding or bleeding that is spurting or profuse that you can't get to be controlled with direct pressure, then those need to go to the ER.
Telehealth expansions could keep you out of a doctor's office altogether. Stormont's MyChart system now has an option for people with existing primary care providers to schedule same-day virtual appointments.
If there are things that you think could easily be managed with a conversation or something that could easily be seen through a video screen, those things might be appropriate.
Sizing up your situation and knowing what care is available can get you on the mend as quickly as possible. Melissa Bruner, 13 News.
Dr. Fowler says urgent care clinics can schedule follow-ups and they can send you on for emergency care if needed. Stormont also still has their good old-fashioned Health Connections phone line available to guide you after hours. That number is 785-354-5225.